meeting. Thank you very much. Excuse me, colleagues. So it is both a privilege, colleagues, and a responsibility to welcome you to this policy dialogue on men's mental health in South Africa, closing the gender gap in policy and practice. I want us to begin by reflecting on why we are convening a policy dialogue. Why is it important that we are doing this? So we are not gathered for a general conversation, colleagues. We are here because there is a clear and urgent policy gap. We've all noted and we've all seen that across South Africa, issues of mental health outcomes reveal a troubling reality. Men are significantly more likely to die by suicide. Even the stats are also saying that. Also, we are reading that less likely, the very same men, they struggle to seek help and more likely to experience mental health challenges in silence. Yet, and despite these realities, policy frameworks and service delivery models have not adequately responded to the specific needs, behaviors, and social context of men and boys. This is what we mean when we speak about closing the gender gap in mental health. It is not about competing priorities. No, it's not. However, it is about recognizing exclusion, identifying blind spots, and strengthening our systems so that they are responsive to all. So now, colleagues, this dialogue is therefore intentional. It is intentional because it is a space where policy meets lived realities, where evidence meets experience, and where we move beyond acknowledging the problem towards shaping systems, narratives, and responses. At the core of today's discussion, it is a need to critically reflect on the terminologies and frameworks we use. Colleagues, I'll be your program facilitator for this session. Now, when we're looking into masculinity, it is not fixed. Others say that it is not a singular identity. Correct. Of course, it is a social construct. It is shaped by culture, history, media, and institutions, and so forth, right? So in many contexts, let's look at masculinity and also give yourself a chance to reflect that masculinity has been associated with a lot of constructs. Let's look at strength. Let's look at men, how they also associate masculinity, right? Also society and their narratives as well as the traditional views. We can say strength without vulnerability. Some people say there is masculinity or hypermasculinity, control without emotional expression, independence without support. Today, we are called to reframe this understanding. We must begin to promote what we refer to as a positive and healthy masculinities, that form of identity that will allow emotional expression, encourage help-seeking, value care, connection, and accountability, but importantly, reject violence, dominance, silence as defining characteristics of manhood. Equally important is our recognition of youth and mental health advocacy as well. Let's not forget our youth. Young men are navigating complex realities in a rapidly changing world. And we need to think now, what is there, right? This rapidly changing world, it is marked by economic uncertainty. You've seen how the economic landscape is now. It is uncertain. It is throwing a lot of men out in the barricades. Identity formation pressures, social media influence, and evolving gender expectation. This brings us to the constitutional mandate that anchors today's work. So I'm going to talk to you more on the role of the Commission for Gender Equality. The Commission for Gender Equality is a Chapter 9 constitutional institution. It is established in terms of Section 18 of the Constitution of the Republic of South Africa. Its mandate is to promote respect for gender equality and the protection, development, and attainment of gender equality in South Africa. Furthermore, The Commission for Gender Equality. In fulfilling its mandate, the Commission is empowered to monitor and evaluate policies and practices of organs of states, statutory bodies, and both the public and private sectors to ensure compliance with gender equality principles. We also investigate complaints relating to gender discrimination and inequalities. We conduct research to deepen understanding of gender dynamics. Also, we educate and raise public awareness on issues of gender equality. We advise Parliament and other state institutions and make recommendations on laws, policies, and practices that affect gender equality. So the Commission for Gender Equality is required to report on issues of concerning gender equality and also challenge systematic discrimination and ensure that South Africa upholds its constitutional and international obligations relating to human rights and equality. Thank you so much, colleagues. I know that I've given you a foundational background on what we are going to be talking about. So in advancing this work, the Commission recognizes that gender equality cannot be achieved through a singular or exclusionary lens. It requires an approach that is inclusive, of course, and also that it goes beyond intersectionality and responsive to the lived realities of all people. Therefore, the Commission for Gender Equality affirms that men and boys are not only participants in the gender equality discourse, but essential partners, rights holders, and beneficiaries of a just and equitable society. Today's dialogue, colleagues, calls us to confront an important paradox. And why are we saying it's a paradox? Yes, indeed, it's a paradox, because while men may, in many contexts, occupy positions of structural power, they are also deeply affected by restrictive norms that discourage vulnerability, emotional expression, and help seeking. So as we proceed, I'm going to invite our Deputy Chair to come and grace us with opening remarks and setting the scene. Deputy Chair, the stage is yours. Thank you very much.
Program Director, commissioners joining us online, distinguished speakers, colleagues, stakeholders, and participants, good morning and welcome. It is an honor to open this important conversation on a subject that has for too long remained on the margins of our public discourse. That is the mental health and well-being of men and boys in South Africa. When we speak about gender equality, we must recognize that achieving equality requires us to understand the lived realities of all people. Gender equality requires us to reflect on the harmful expectations placed on men and boys that often discourage vulnerability, emotional expression, and seeking support. Today's discussion invites us to challenge those assumptions. Men's mental health cannot be separated from the broader social conditions in which people live. Issues such as economic pressure, unemployment, social isolation, violence, substance abuse, and expectations around masculinity all influence how men experience and respond to those challenges. The Commission for Gender Equality's work on men, masculinities, and gangs has highlighted how factors such as poverty, lack of opportunities, disrupt family structures, and the search for identity and belonging can shape the experiences of men and boys. This reminds us that mental health is not only an individual matter, but also a social and policy concern. As we discuss closing the gender gap in policy and practice, we must ask whether our programs and services are reaching men and boys effectively, and whether we are creating a safe space where men can seek help without fear or stigma. We must promote healthier forms of masculinity based on respect, accountability, emotional intelligence, and care. This conversation requires collaboration between government, civil society, researchers, communities, families, health practitioners, and men themselves. Today provides an opportunity to move beyond viewing men's mental health only through crisis towards building sustainable approaches that promote prevention, dignity, support, and inclusion. I wish everyone a meaningful and productive engagement. Thank you.
Thank you very much. Thank you to our Deputy Chairperson, Prabhashini Subrayan Naidu, for those insightful and grounding reflections. We now move into a critical part of the program, colleagues, our keynote address, which will provide the conceptual and evidence-based based foundation for today's dialogue. Colleagues, this session will unpack key issues shaping men's mental health, suicide trends among men, the social determinants that influence mental well-being, the role of masculinity in shaping behavior, and the persistent barriers that prevent men from seeking help. So, colleagues, these issues challenge us to move beyond individual level explanations and towards understanding the structural and cultural dynamics that influence mental health outcomes. I also want us to have compassion as we move along with this program. It is my honor to invite Mr. Mzamo Mbuli to deliver this keynote address. Sir, you may take the platform. Mr. Mbuli.
Thank you so much, ma'am. Am I audible?
Yes, you are audible.
Okay, I just want to share my screen with you, and then I shall start. Can you see my screen?
Yes, I can see it.
Okay. Thank you so much, ma'am, for the invitation, firstly. It is Men's Mental Health Month in South Africa this month, as long as Youth Month. So when you asked me, I had to do a bit of introspection on the work that I do and the team that I work with, that we do in terms of men's mental health. So thank you for the invitation, and thank you for the opportunity for giving me. Just by way of enunciation, as you've said, I'm Mzamo Mbuli. I'm a clinical psychologist. I'm based here in Ekurhuleni. I'm the coordinator for the South District in Ekurhuleni. So we're overseeing 32 clinics in the South District. I've got colleagues, a team of 9 psychologists and 2 registered counselors. And part of our work, as it is, especially for next month, it's mental health month next month. It's also Nelson Mandela Day. And like you said, or like I said earlier on, this month we're particularly focusing on men's mental health. So it's something that we are doing. So just by way of introduction, my presentation today is understanding men's mental health, suicide trends, risk factors, masculinity, and help seeking behaviors. I do need to point out in every presentation that I do, because even us as professionals sometimes get it wrong when we're speaking about mental health and we're talking about mental illness. So most people, when they're talking about mental health, they actually speak about mental illness. And when we're speaking about mental illness, they speak about mental health. So I just want to delineate those definitions. So when we speak about mental health, according to the World Health Organization, we're speaking about a man's ability to reach one's potential. We're speaking about a man's ability to contribute positively to the community. We're also speaking about a man's ability to cope with everyday stress. So briefly, when we talk about mental health, that's what we're talking about. It's not necessarily the absence of mental illness. And then mental illness, I think we all know what that is, but just a short oversight. There's close to 300 types of mental illnesses, divided into 20 categories. Mood disorders, anxiety disorders, personality disorders, schizophrenic types of disorders, trauma-related disorders, and so forth and so forth and so forth. But for today's presentation, I think we're going to focus more on your depression, because that's mostly where we find suicide. We're also going to be looking at the suicide stats of South Africa and abroad. We're going to be looking at the risk factors for male suicide specifically. And then we're going to be talking about the barriers for men to seek help. And then just from my point of view, more of a psychodynamic point of view on as to why men commit suicide. I think our previous speaker, Deputy Chairperson, when she was outlining today's event, she spoke about we can't separate culture, we can't separate poverty, and all these other important variables when we're talking about men's mental health. And we can't separate them when we're talking about men's mental illness, because sometimes those are the very factors that can cause mental illness in men, in particular suicide. We're also going to be looking at possible treatment solutions, and maybe I'll just share as a team what we've done in the South. And one of the issues that we find, obviously most clinical psychologists, most registered counselors, most social workers are female. So when we do these men's conferences and men's workshops, and we go into churches, we go into schools, sometimes men are reluctant to be vulnerable in those spaces. Obviously, you want men to be vulnerable and talk about mental health and mental illness, but the mere fact that it's being presented by women is sometimes a challenge. It's just a thing that we have to deal with, because most people in our profession, especially psychologists, are female. It's just one of the challenges that we have. Looking at stats, approximately 1 in 8 people globally have a mental disorder. I would argue and say that it's a bit more, just from my own experience. In South Africa, men account for approximately 75 to 80% of completed suicides. And bearing in mind, as we all know, men are more successful at completing suicide as compared to the other gender. And that is because men use more lethal means of committing suicide. We'll get to the why later on in the presentation. According to the World Health Organization, 4 out of 5 suicides in South Africa are committed by men. Out of the 13,000 recorded suicides in South Africa, 10,000 of those suicides are from men.
Excuse me, Mr. Mbuli. Sorry to interject. I'm getting messages that there is no sound. So I want to just find out from our colleagues who's struggling with sound, because I'm getting messages. So I just want to also ask our comms to help us with sound, please. And maybe on your side, sir, if maybe you can adjust your mic, because even from my side, the sound is very soft. You are very, very faint.
It's very faint to me.
Yes. So colleagues are saying there is no sound at all.
Okay. No worries. Just do this. Okay, the mic is on. Let's see sound here.
Okay.
I've just turned up the volume. Is it better?
Yes, it's much better. Maybe let's get a feeling from the colleagues, participants. Continue talking. Okay, I see. All right, no, we can proceed.
Oh, it's much better.
Thank you.
All right. Thank you so much, ma'am. Wait. So I was saying, like in South Africa, 23 to 25 suicides are committed per day, and majority of those suicides being men. Men are significantly less likely than women to access psychological services. I think it's not just psychological services, but also any health services. We used to have in South Africa Movember. I think it died down during COVID. So we'd commit the whole month of November to men's general well-being, whether it's health, mental, and so forth. And even medical practitioners share the same sentiment that men are less likely to engage with professionals in terms of prevention, testing for prostate cancer, and so forth, as compared to females. We spoke about the many different types of mental illness, but even mental illness is different in men compared to women. In fact, I always say to people, it's easier for some people to see that they're depressed. Maybe they're crying, they withdraw, they self-isolate. But depression in children and in men is very different. And because it's different, I suspect that it's less diagnosed and it's less visible for the normal person to see on the street. It mostly manifests as anger in men. That's the main symptom of depression. Another symptom that's very common in men when we do have depression is irritability, and sometimes our depression is even masked by another mental illness, which is substance use or misuse or abuse. Men sometimes when we are depressed, we cope using substances, and maybe that substance use is a cover actually for the actual depression. Another symptom or sign the sign of depression in men is risk-taking behavior. You guys know, colleagues, that insurances are less likely to insure men, hence the higher premiums. That's because of our risk-taking behavior in men. So if you find your husband or your child, your male child, your male colleague taking more risks, being a bit more impulsive, that might be a sign of depression. The important point here is that depression manifests differently in men than in women. Also, what I like telling men in these types of contexts is that, yes, we all know that there's depression, but people don't know that there's different types of depression. So you can have a mild type of depression, you can have a moderate type of depression, but we also have severe depression. And when people are severely depressed, or if men are severely depressed, that's when we see people becoming psychotic, talking to themselves, seeing things that we don't see. But also, when men are severely depressed, or when people are generally severely depressed, that's when we see the suicide, or people attempting to commit suicide. Another colleague of mine, she's a registered counselor in the East. She was speaking about why people commit suicide. I liked what she said. I'm just going to quote what she said. She was asking the floor, why do you think people commit suicide? And she answered by saying, when people lose the purpose of living is usually when we commit suicide. Barriers to help-seeking behaviors in our context, especially in the clinics that we work in, is obviously it's the stigma, and I think even though we have very few male patients, for example, in a week, I would see, let's say, 25 to maybe 20 patients. Out of those, it will only be 5 male patients that I've seen. And most of those male patients that are there, it's by referral. So they're referred by somebody else. Very few times that I've seen that males refer themselves for therapy. And maybe just a sad story to share with you guys as well, in terms of my lived experience in treating men's mental illness. Even the men that do seek help, that are not seeing a psychiatrist or a psychologist, or even seeing both, in terms of suicide, my 2 last patients that have committed suicide, they were actually men who were mental health users. That's what we call them. But they committed suicide while they were getting help from the psychiatrist in a specific clinic that I work. I spoke about the systemic gaps that we have, i.e., lots of female registered counselors and clinical psychologists that we have that are helping, but obviously that doesn't help in some men being open. Then there's also lack of language. I think you'll see when we're speaking about treatment and possible solutions to this, males don't have a narrative or a language for identifying and naming their emotions. We're very good at intellectualizing our experiences, but not identifying what I'm actually feeling, which is a major barrier to seeking help. Harmful gender norms. Ma'am spoke about that in terms of toxic masculinity, in culture, how we assign gender roles to men. Men don't cry and so forth. I'll just touch on that a bit later. Another important factor, especially for where I'm working, in the east of Johannesburg, intergenerational trauma. So especially in the east, your Katlehong, your Vosloorus, your Eden Parks, and all of that. Due to what happened in the 90s, late 80s in South Africa, that political violence, let's say those young men were young at the time. They are now obviously fathers, they are older men, but due to the violence that they were exposed to during those times, and maybe they haven't processed that trauma, makes them more vulnerable to violence right now. And even apart from that, if a person, male or female, comes from a violent home, that obviously makes them more vulnerable or susceptible to violence. Is that intergenerational trauma? Or that intergenerational trauma, I would say, that hasn't been processed. Some of the risk factors, I think, again, our deputy speaker spoke about that. And also when we're speaking about mental illness, it is something as clinicians, sometimes we miss. We just diagnose, okay, this person is depressed, this person has post-traumatic stress and so forth, but sometimes it's not always psychological. Sometimes, especially in our context where we work, it's very social. Men are unemployed. There's poverty. Men can't provide for their families as a determining factor in mental illness and depression and suicide. We spoke about harmful gender norms. Men don't cry. Men must provide and so forth. And also, again, intergenerational trauma. And then I'm just going to speak from a psychologist's point of view. Yes, we know these things, but I'm just going to add a layer of psychodynamics to it as to why actually men commit suicide. So everything that we've been speaking about today, even the previous speakers, is actually about early attachment and a boy's emotional development. So when we grow up in a society that gives us messages of boys don't cry, be strong, be stoic, don't show weakness, that curtails boys' emotional development, i.e. what we spoke about. We're not able to identify. We sometimes not even able to recognize the emotions that we are feeling. Men may learn that emotional vulnerability threatens attachments and acceptance rather than integrating painful emotions, and they repress or split them off. And I think this is especially true in romantic or in romantic relationships. So if someone is married, that lack of emotional development, those early attachment issues are very prevalent. If you work with men, even in the workplace, this is how it would show up. The second reason would be the masculine superego. I think what a previous speaker spoke about. So if you think about, even if you don't know psychology, you can think of the superego as our culture, as our community, as our own lived experience. And from a psychology point of view, many men internalize these social norms, these social narratives that are out there, especially from the family, from the home, and the broader society. A real man never fails. So if you think of that, and you're a man, you're unemployed, you can't provide for your family. You can't even provide for your family of origin, for example. Therefore, it means I'm a failure. Needing help is a weakness. I must provide regardless of my personal cost. So we see a lot of this in people and in men who are depressed because of the social pressures of I must provide, I must provide, I must provide. I don't even get to use my salary on myself, and sometimes my family, my wife and my child, because I'm providing for everybody else. I'm the last person to look after myself, and yet I'm looking after everybody else. There's also like risk factors like unemployment, like we spoke about, but especially divorce. I find this a lot in both public and private spaces. When men lose their family, i.e. their wives or their husbands and their children, and the threat of being abandoned by a family is a big risk factor for men for committing suicide. Psychology, we speak of a narcissistic injury. In short, a narcissistic injury occurs when a person's sense of self-worth collapses. So for example, let's say a man grew up not having means, so the whole drive and motivation is to I will not be poor, so I'm going to work hard, study hard to be successful, and the person does that, or that man does it so much so that they neglect maybe the wife or the husband, they neglect the emotional needs of their children, and because of that, we spoke about divorce. They disconnect from their family, and that lack of success, that yes, I'm successful maybe in the workplace, but I'm not successful with my own family, we would call like a narcissistic injury, which would cause men to commit suicide. This one's very important. I think most male patients, most men in general, even if they're not patients, do this. Again, due to the inability to recognize and process emotions, in particular anger. So in psychology, we have what we call introjection. So instead of the anger being projected outwards, the anger I introject on myself. And a perfect example of this is suicide. It's the ultimate act of aggression on the self, due to maybe excessive guilt, due to maybe I feel so worthless that I can't provide. I'm going to take that anger and explode it on myself by taking my own life. The other reason why possibly like men commit suicide is defenses. I think most of us are familiar with psychological defenses, but there's different types of psychological defenses, some mature, some immature. For example, humor, when somebody makes light of a difficult situation, we call this a mature defense. But I think most men, the types of defense that they use is often denial. For example, I'm going to deny my lived experience. I'm going to deny how I actually feel inside. For example, I'm fine. The other one that we spoke about is intellectualization. Men are very good at intellectualizing and rationalizing problems without actually experiencing the emotions that they're experiencing of that problem. Another defense that is very common among men, this is what we usually see when we speak about those signs and symptoms of depression, is aggression. Acting out, even drinking is a sign of acting out. Instead of addressing what's internally happening with me, I'm going to act out the aggression, i.e. suicide. Another psychological term for us colleagues is alexithymia. So alexithymia means instead of recognizing the feeling that I feel abandoned or I feel ashamed, we as men manifest the emotion outwardly. Instead of identifying that emotion, instead of recognizing that emotion, that emotion will be taken outwardly. And sometimes men will present to the general practitioner with headaches, with pain in my stomach, and it looks like a medical problem, but it's actually a psychological phenomenon that I'm not dealing with my emotions. I'm not dealing with the tension that I'm experiencing. I'm not dealing with the anger, the numbness that I'm experiencing. So in short, when we're talking about why do men commit suicide more often, it's because of restricted emotional expression, a strong reliance on defenses, harsh internal critique, i.e. punitive ego, us living up to these social norms, these social constructs of masculinity or toxic masculinity. One that we didn't touch on is obviously identity. My identity being tied to achievement and control and providing. We also spoke about narcissistic injury. We spoke about these things being a barrier to help-seeking behavior. And the depression and the suicide becomes internalized due to the unbearable psychic pain. So some possible treatments. I've spoken about what we do as a team. So for example, yes, we host men's workshops or men's conferences and all of these things where we invite only men. But we've learned that we need to be a bit more creative in sometimes doing these things, because men won't just bring themselves. So for example, next month we've got an event where it's primarily a music event, an R&B soul music event where we're inviting people to come and listen to music. But before all of that, we'll have a psychologist that will speak specifically to men's mental health before they not a concert, before the music is played, for example, to bring other men into the space. Also, in these men's conferences and workshops and so forth, sometimes when we're speaking to men and we're engaging and so forth, I've realized that men, even though I don't agree with some of the things that they say, for example, men will say we are more victimized than women, we are more raped than women, things like that. But I see it as more as a cry for help, and they don't have these spaces to express their feelings. They don't have opportunity to talk about the things that men go through, especially shame of not being able to provide for their families. And it's happened sometimes that we have an event at a clinic or so forth. We speak after the event that some men actually come up to one of us like, hey, actually, you know, what you were speaking about, I actually want to take my life, and you'd have to refer that person to the hospital. So having talks like this, like the guys that you have given me an opportunity. Yes, obviously you guys talking about more policy engagement and so forth, but it's important because policy can go a long way, especially in our work environments, and make it more male friendly for males to be more vulnerable. A previous speaker also spoke about exploring unconscious beliefs about masculinity, dependence, and vulnerability. And like I said, it's what's helpful is developing more capacity to seek and accept support. And for myself, just a personal reflection is for us to be more reflexive. Yes, we do this job every day, but because I had to present today in a different setting, I also had to be reflexive about, okay, but what we are doing, these workshops that we're doing for men, are we effective in what we're doing and so forth. Thank you, colleagues. Any questions?
Thank you very much, Mr. Mbuli. Thank you so much for that deeply insightful and thought-provoking address. Yes, indeed, your reflections remind us that addressing men's mental health requires us to transform, right? To pay attention to different spectrums of mental health, suicide, depression, as well as their manifestations. So before I can call on the next speaker, I just want to assure our colleagues, our participants, that we are going to get our moment where we will ask questions, share our concerns, and also bring out, solutions to the panelists or to this conversation. I just want you to note down your questions, your concerns, or anything else that you desire to ask the panelists. So as I transition to the next segment, we now turn our attention to the question of systems and accountability. So while awareness, colleagues, of mental health challenges continues to grow, there remains a significant gap between policy intentions and lived realities. So what does this then raise? We need to be critical and also have critical reflections on this, because currently our current policies are they sufficiently responsive to specific needs of men and boys? Have that in mind. Do service delivery mechanisms adequately address barriers such as stigma, accessibility, and cultural relevance? And how do we ensure that policies translate into meaningful, measurable impact? So this session calls us to critically assess not only what exists. Remember, this is a policy dialogue that we want to bridge, the gap between policy and practice. So we need to assess what currently exists, but also what is missing. It is my pleasure now to invite Ms. Estelle Otto to guide us through this discussion. So Ms. Estelle Otto, for 15 years, she has been part of the Victim Empowerment Program at the Gauteng Department of Social Development, working with NPOs, also curbing the gender-based violence program, and as well as rendering awareness campaigns in communities to end gender-based violence and femicide. It is my pleasure to have you, Ms. Estelle Otto, to guide us through this discussion. Thank you. Ms. Otto, are you able to hear me?
Program Director, I think we are having challenges with Ms. Otto. She's unable to connect. She just sent me a text. She's been struggling with connections. I'm not sure if there's anyone who can assist there on that regard.
Okay, thank you for letting us know. Okay, in the meantime, I am requesting that we then move to our next speaker, to Mr. Changa, while we sort out Ms. Otto. Apologies, colleagues. Before we can call upon Mr. Mhlanga, maybe let me just brief you a bit. So the way we have structured this dialogue is that we were supposed to be learning more on systems and accountability and critically reflecting on what exists and what is missing. So Mr. Mongezi Mhlanga is then going to supplement. So as we reflect on policy gaps, it is equally important to recognize that the role of grassroots and community-based platforms, particularly men's forums, right? These are spaces that have potential to foster open dialogue, provide peer support, and challenge harmful norms from within communities. However, we want to understand, and also build on of existing knowledge, the effectiveness that depends on intentional design and sustainability of the men's forums. So this session invites us to think as well, how do we move from, informal dialogue spaces to impactful structures that influence behavior policy within the structures of the men's forum, whether in the workplace, in grassroots communities, or in community-based platforms. So I now invite the chairperson of the Men's Forum from the Gauteng Department of Social Development, Mr. Mongezi Mhlanga. Mr. Mongezi, you may take the floor. Thank you. Mr. Mhlanga, are you there?
Apologies, colleagues. It seems that a few of our speakers are having connectivity challenges, but we are sorting it out. Please just give us 5 minutes and we apologize for these glitches.
Apologies, colleagues, for those technical glitches. But then we have resolved to call upon the next speaker. I'll be calling upon Mr. Teboho Utwenya from the Department of Justice and Constitutional Development. So maybe let me just give a background. Mr. Teboho Mutlanya, with his role, the men's mental health is improving access to family justice services. So mental health does not exist outside of legal and institutional systems and institutions, colleagues. Family justice processes, such as matters relating to custody, maintenance, and parental rights, can have profound emotional and psychological impacts. I think we also heard it when Mr. Mbuli was addressing us. So for many men, they are navigating a lot. And you know that for many men, navigating these systems can be complex. Some of them, they don't even know where to start because there's low awareness. And also it becomes emotionally taxing and at times experienced as exclusionary or inaccessible. There's also a stereotype, or a certain narrative to say, oh no, the law is for women. Actually, it's not, So this session challenges us to consider, how do we ensure fairness and equity within family justice systems, and how do these systems contribute to or alleviate mental health challenges? I now invite Mr. Teboho Motlonya to the room. Thank you very much.
Thank you very much, Program Director. And believe you me, the invite, it's much appreciated. And thank you very much for considering us as a department. And we solely appreciate the platform that the Commission is giving us. And I would like to start by saying, among other things and role and responsibilities that the department has, internally, we also have our own men's forum structure, which I'm the national chairperson of that structure. And within the Department of Justice Men's Forum, our mandate is to address and resolve issues that are affecting men within the department and also outside the department. And the other thing that we are also doing within the department is to close the gap between a father and a son in terms of us creating a platform and sharing the platform to address issues that are affecting a boy child. However, for today, I was asked to address the issue of family justice systems. In terms of family justice systems, one key factor that is contributing to men's mental health, it's divorce. As and when there's a divorce within the family, obviously there's a break of a relationship. And in most cases, people that are suffering in most cases will either be a child, or the mother or the woman will use the child as a weapon in that process. And this process of divorce, it's affecting all parties. But at the end, the one person that will suffer most is a boy child or a girl child. And it's one of the areas that from divorce, that's why we find men are affected in terms of their psychological and mental well-being. Because now remember, the setup is no longer the same. Previously, the child will be within the family. Now, the child in most cases, they stay with their mothers, and then the father will have a challenge in terms of visits and making sure that they spend time with their kids. So in most cases, that's where the challenge is in terms of what we've been monitoring and researching. And most men are not aware that there's a certain unit within family courts that we call children's court. That's where the frustration of men can be alleviated, because as soon as you approach the magistrate court, and in terms of our Children's Court Act, the parent or the father who wants to come to the children's court must follow where the child is in terms of the act. So meaning if I'm residing in Vereeniging and the child is residing in Pretoria, I must approach the court in Pretoria, the children's court in Pretoria, to go and apply for what we call a parental plan. A parental plan will be a court order where a child will be allowed to visit their parents in terms of that court order. So meaning it will be a court order endorsed by a magistrate. Violation of such will be treated as a violation of a court order, and there will be consequences if parties are not adhering to the court order. And one entity also within the department that is also affecting men as well as kids is the maintenance. Maintenance is used as a weapon or as a tool to fight battles between both parents. In most cases, the beneficiary of a maintenance is the child. And in most cases, especially this is emanating from the COVID era. Most men, some of them, they lost their jobs from COVID, and now they are unable to maintain their kids as they used to do. And now the woman will say, because of you are not maintaining your child, therefore you're not going to be able to see the child, which has nothing to do with maintenance. And remember, as I was saying earlier on when I started, I alluded that in most cases, the people that are suffering are kids and men, because of tools such as divorce maintenance will be used against them. And they don't know their rights in terms of where to go, how to address these issues. So most cases, maintenance is used as a fighting tool between the two parties. And also it's affecting a man in the sense that now that I'm unable to pay maintenance because I'm no longer working, therefore I'm not equipped, I'm not well enough, I'm not good enough to be a father to my child. And I would also like to share a certain story emanating from this, what I've just said. There's a gentleman that I've met recently when we were doing one of our sessions where we engage with men. And it was organized by the Department of Community Safety. The gentleman was saying to me, he used to work, but now he's unemployed. And he was told that you are a no good father now that you are not able to provide for the child. And he recently, the child had an assignment or activity that he needed to do. However, the child needed data. And him being a present father, because he know that he's unable to buy, he took the child, they walked, he took the child to the nearest mall where there's a free Wi-Fi. And the child was able to do the assignment and complete the assignment as it requires internet. And they went back home. So we are saying men can play a vital role to their kids by being present fathers. And not only will this assist the child, but it will also assist our own mental health as men, because we are deprived of our rights because of economical issues. And a father is a father because of him being present, partaking in a well-being and looking after the child, not only financial, but also being a present father. So those are the contributing factors to us as men that are affecting us psychologically. And we are faced with this on a daily basis. And we are advocating for men to come forth and resolve these issues and attend to these issues so that they can be there for their kids. And the only way for them to be there is for them to be present fathers and approaching us as cause to say, hey, I have an issue here. I'm not allowed to see my child. I need to see my child. I want to have a relationship with my child. Because at the end of the day, the recipient of this will be a child. The child will feel neglected, especially a boy child will feel neglected. And then we expect a boy child in the near future to be a father. to be someone's husband, to be someone's son-in-law, but they are damaged because the damage is coming from the divorce. The damage is coming from them being alienated from having a proper relationship with their fathers. And those are the people that are supposed to guide and show path to these boys to say, this is how things are done. This is how you build yourself as a man. So we are applauding to say, we as the Department of Justice, our services are accessible, our services are free, and we appeal to those that have people within their scope of work that needs this assistance to approach us so that we can alleviate these issues that are affecting our mental health as men. And we support the cause in terms of men's mental health. And I'm very grateful that this platform is given to us. And it's also reflecting to us as men in terms of our month of mental health. And also not excluding the significance of this month also, which is also a youth month. We are building a South Africa that needs youth to stand up and stand firm in terms of their constitutional rights and come to the forth and fight the cause of broken families so that we can mend and close the narrow gap that we see in our society between a boy child and a girl child. I thank you, Chairperson.
Thank you very much. Thank you, sir. Colleagues, I hope you are noting down. I also want to welcome colleagues who have just joined us. Welcome to the policy dialogue on men's mental health. We are indeed closing the gap between policy and practices. Colleagues, we are continuing, and on the next segment, we want to look into the media, masculinity, and mental health. So the way society really understands masculinity, we know that it is also drawn from how the media has also perpetuated the ideal male or the ideal masculinity, right? So it is often shaped by the stories we tell, the heroism, the political commentary, and the stories we consume that really at the end of the day looks into how masculinity should be understood. So in this regard, media plays a powerful role in defining social norms, reinforcing stereotypes, and shaping expectations of what it means to be a man. So quite too often, these narratives promote strength without vulnerability, resilience without support, and independence without connection. This has real consequences for mental health. This session invites us to critically look into the following. How can media become a tool for transformation rather than reinforcement of harmful norms? Before I can call the next speaker, I just want to share with you of who he is. Mr. Jabu Sibanyoni is the acting channel manager for the Urban Brew Studios channels, Dumisa and One Gospel. He holds a Bachelor of Law degree and is currently pursuing a Master of Laws at the University of Johannesburg with more than 15 years of experience in the television industry. He has built extensive expertise in channel management, content strategy, and broadcast operations, contributing to the growth and success of the channel brands. So it is my honor and to invite you to the session, Mr. Jabu Sibanyoni. Thank you very much.
Good morning, colleagues. Please tell me if you are seeing my screen and are able to hear me.
Yes, I'm able to see your screen and you are audible. Thank you.
Thank you. Let me begin by just a personal story. So yesterday when I was still just looking at my notes for this session, I received a call, right, from my sister-in-law. Was requesting for me to come through because they were having an issue with my brother, right? So I went through and I found my brother in a very terrible situation where he was crying and all emotional. And you know what was the hurting part? The hurting part was the fact that the lady, the wife, wasn't seeing a problem. He was saying uyatefa. In the way uyatefa means he's being all emotional unnecessarily, right? And I sort of managed to calm the situation down and I got to understand his part. And I think the situation sort of reflected because I knew that yesterday we were having this session, which really is a reflection of what I was dealing with yesterday. So there is a need to have these dialogues, and I thank you for inviting me. I'll just get straight into it. So sorry, not moving. I don't know. Okay, yes. So we, as the media, play quite a crucial role, right, in everything that happens. Because remember, as a society, as a people, we're a reflection of what we see, a reflection of what we read, a reflection of what we watch, right? A lot of our content, the content that we consume, is content that is reflective of our reality or is reflective of our myth, and that is content is done by us for us, right? And part of the part of content development, sometimes we look into, in fact, most of the time we look into these issues just to understand what is happening in the society when we are creating stories that are going to speak to the society. I think just as touching on it, we recently watched Jonas, right, the polygamist, and I think at the core of Jonas, he's just a man who has been dealing with traumas, mental traumas that happened earlier in his life, which he did not understand, and now when he's growing up or as he has grown and is able has been able to attain some wealth, now that trauma that he didn't deal with is coming into play, right? And we all watch this story, and you know what's the sad part about the story is that all of us sort of have a reference. We all know a Jonas, or we've all read about a Jonas, or we've all seen a Jonas next door, right? So my introduction, I'm just going to touch base on 4 points. I'm going to be as quick as possible. These are media reinforcement of the traditional masculine ideas. My second point will be on the social media reshaping masculine identity. And the third point will then be the masculine identity affecting mental health outcomes. And then point number 4, I just want to zoom into our South African context, right? And then we'll speak about the positivity of everything that is happening. You'll say if you are not hearing me, colleagues. So as the first point, right, media, including television, which is us, music, sports, advertising, recently podcasts, and social media, have a certain way in which they portray men, right? And this is something that we all know because that's where we come from. What it is, typically, a man must be strong and emotionally controlled, right? When there is a situation at home, there is expectation that a man knows how to calm the situation. It doesn't matter where the man is mentally, it doesn't matter what he's dealing with, but because he's a man, and the reflection thereof is that he should be strong and emotionally controlled, right? Uyindoda, there must be that masculinity that shows. And this we see in our shows, right? Even on TV. And then a man, again, is supposed to be a financial provider and a family protector. This, again, we know. We grew up watching our fathers trying to, by all means, carry this role. And the role has sort of went down, and it has its consequences. We'll speak about it. And it also speaks of men being dominant, independent, and resilient, because, again, he's a man. There must be that. And then, again, the portrayal is that a man must be unwilling to show vulnerability or seek help, right? Again, this lives in many of our cultures, right? There's that thing where you are when you are advised, there's always that mfana, don't show your weakness, in fact, in the polygamist, we watched how Jonas was trying to feed into the boy, right? Yendoda, you must be a man. And this again is, like I'm saying, our everyday life that we are watching on TV right now. where is the danger? These can create pressure on men, right? And these are particularly men who, well, cannot meet the expectations, right, due to various reasons. There's quite a lot of them. It could be unemployment. In fact, mental health is the first one. When a man is dealing with his mental health issues, there is a lot of things that he tries to minus or he tries to get rid of in his life. Um, 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 there is that level of being irritated, when people, because he's in his own world. And you know what? The difficult part about this world, it's all mental. So it's in the mind, it can't be seen. Um, so yeah, the, that's the idea of the men, right? What are the results? Like I'm saying, the results are stress, emotional suppression, and reduced healthcare seeking. Because as men, we know again, a man does not want to go and be vulnerable and check. Though we must say, as we are speaking about this, that quite the newer generation of men is changing the narrative, right? Which is a positivity, because I've seen quite a lot of organizations advocating for that. As a man, go get checked, because also again, some of the mental health issues come from our health issues which we've not identified, or we are not dealing with knowingly and unknowingly. And then there's the social media, which also shapes the masculine identity, right? So social media, as we know, has become sort of like an important space where masculinity is negotiated. We see it everywhere. We see it on Twitter. We see it on Facebook, right? And what are these? These are some of like mental health campaigns which are positive. I've seen on TikTok there are guys that meet every now and then just to address their mental health issues. That is positivism, right? And then there are male role models discussing depression, anxiety, and fatherhood and vulnerability amongst those, right? We've seen quite a lot of content that has men that are being vulnerable or encouraging men to be vulnerable, again, which are happening in our social media. And what is nice about the social media space is that the space is not necessarily controlled, right? As how we are as a television channel, or how media, for example, is controlled by editors. And then there's also online support communities, right, which are normalizing seeking help, which is good because all this is seen on media. And what is nice about media as well is that once you start watching that content, right, then algorithm throws you more of the content which is around the same topic or around the same content, which is good, right? And then on the social media, there's also its own negativities. What it is, there's an influencing of promoting hyper masculinity, which is happening on the social media again. We see it every day, right? There's also content that is suggesting that emotional expression is weakness. Like I was mentioning the Jonas show, to say Jonas kept on saying to the boy, you need to. And again, throughout or towards the end of the story, we saw the boy starting to shape into being what was, sort of wished for. But on the negativity again, then he started picking on the attributes of the father, saying, I want to be like my father, which also, again, is sort of a typical example of how a polygamist come from a polygamous family, right? There's also that connection. And then there are also messages which are linking masculinity to wealth, dominance, or sexual, right? Again, this we've seen where in the society generally, quite a lot of men feel like they're not doing enough because you are driving your city golf and the man next door is driving a G-Wagon. Those are some of the stresses that and all of a sudden women are like, in-daughter must show up. If you are a man and you don't have a car, already there is a negative narrative around you, particularly to women. Those are some of the issues that we men have to deal with. And then when it comes to masculine identity, which is affecting mental health outcomes, right? Adherence to traditional masculine norms is often associated with lower likelihood of seeking psychological help. And it's good because some of the colleagues that have spoken before have touched based on this. So I'm just going to cross. There's greater emotional suppression, which again we know there's higher levels of depression that often present themselves as anger, aggression, or substance misuse. right? There's also increased suicidal risks, which the colleagues have also touched based on. And then there's higher alcohol and drug use as coping mechanism or strategies, right? And I came across a study that was done in 2025 amongst South African college men, found that many participants avoided seeking help because they believe men do not talk about their problems. Uma uyindoda, you don't speak about your problems. That is seen as a weakness, right? And that is obviously reflecting socialization into ideals of toughness and self-reliance for men. And then in terms of the unique South African context, the media influences masculinity within broader structural challenges. What is, again, these include high unemployment among young men, particularly because also there's been a shift economically, right? We know it. And then there's persistent economic inequality, there's violence and crime, there's historical legacies of apartheid. I think another colleague touched based on that, affecting family structures and gender roles, right? Then there's high rates of gender-based violence, which we talk about every day and we know. So these conditions can intensify pressure on men to prove masculinity through financial success, dominance. Again, we've seen it quite a lot of women, particularly also on the socials, are like, you'd rather abuse me, but I, go to a paint, or I wake up to a paint, or I wake up in a mansion, and that to a certain extent is also influencing the younger generation of girls, which are seeing, this trend and are being adaptive to the trend. And then the positivities. I spoke about this earlier to say we've seen initiatives increasingly promote healthier models of masculinity by encouraging emotional literacy, help seeking as a sign of strength, positivism, positive fatherhood, gender equality, healthy relationships, and non-violent conflicts. Because what is nice about the media as we know it and as it is currently is that we all have access to the media. We all have access to TV. We all have access to, social medias through our phones, and we have laptops and all of that. So the teaching is no longer necessarily a home thing. Teaching goes all the way to media because what the kids watch is what influences their thinking after all, right? That's why what is nice, again, according to the trends and the research, quite a lot of parents are starting to guide what their children are watching, trying to contribute towards that positive society. And then media today, most content is consumed on the socials. I've touched based on this, where there's no editors, there's no commissioning editors and control policies. That is both negative and positive. The positivity about it is what? At this point, everyone is speaking about the Madlanga Commission. So in the media space, if you're not speaking about that, then you are not relevant, and people want to consume content that is relevant. So the nicest part about this is that on the socials, then people are watching it because they want to watch it, which is a good one. And then there's also people who are who are taking control. This we've seen on the socials, just so that they don't depend on the traditional TV or traditional media, just to ensure that these movements are happening and these conversations are happening. Because also, like I highlighted earlier, as we commission or as shows are commissioned, the society is looked at to say what is it that is trending. And unfortunately, one of the trendy topics in South African context, TV sells if there's crime, right? Which is a bad part in terms of the reflection, because it means as a community, we love consuming content that is that has anger, that is, that shows, and then that perpetuates this masculinity that we are speaking about. Right, and also within our shows, then there's that element of saying you must suppress, you do not, which overall affects the space, which affects how the communities think and how the communities are shaped. In terms of the traditional media, I said it, there is a need for an effective narrative. What is the effective narrative? These are stories that are real, that are reflecting on the real people, that also have some sort of level of positivism, because I think it would be nice to watch a show that reflects who I am, a man that is, well, typical South African man. He's trying, he's unemployed, he's looking for jobs, and the wife, on the other hand, is supporting him, just so that the narratives, are countered. Because if there's no counter narrative, then it shows to say a man must push whatever it takes, even if it compromises his mental health. He must just push and make sure that he gets money, because when you get money, then you are masculine, then you can take control, then you can have an influence. We know it. This I'm just touch basing. For those who are coming from typical Black families, we know that there is an uncle that if he hasn't pulled up or he hasn't come through, a cow won't be slaughtered, because that guy is the masculine man in the family, right? And again, all of us have a role to play, and stories are created by real people, which is us. So we look forward to receiving those stories that really are touch basing on this concept that we're speaking about and the situation as is. Colleagues, that's it from my side. Thank you. Sorry, I'm trying to get something. Yeah, that's it. Okay. So I wanted to say again, it starts with us, and all of us have a role to play. Let's keep on fighting. Thank you.
Thank you very much. But it shouldn't be a violent fight.
Obviously.
Okay, thank you very much, Mr. Sibanyoni, for taking us through that important discussion. So before I can call upon the next speaker, let me just sincerely apologize. We have unfortunately lost 2 speakers due to their email domain. So it looks like they won't be able to present, and they are both from the Department of Social Development. But do not despair. Let's continue. So we were graced with how media can become a tool for transformation rather than a reinforcement of harmful norms, right? So now we are going into the community, right? Community level, where real change takes place and where real change takes root. So we are now going to look into how community-based approaches are critical, because they reflect local realities, build trust, and provide accessible, culturally relevant support systems. So they allow interventions to meet individuals where they are, rather than expecting individuals to navigate distant or unfamiliar systems. This session challenges us to think about the following. How do we scale and sustain community-driven solutions in a way that ensures consistency, impact, and a long-term change? Before I can call upon Mr. Sidwell, so Mr. Sidwell Sihauna is a seasoned gender specialist, monitoring and evaluation manager at ADAPT. He has extensive experience in developing and implementing gender-based violence-related programs, and is a qualified facilitator, moderator, and assessor by profession. As one of ADAPT's senior facilitators, Mr. Sihauna leads employer-focused projects where he develops training materials and facilitates workshops for employees, educators, community members, and various stakeholder groups. I think this is also an opportunity for us as a community to really maybe, form synergies and think of future collaboration opportunities here. So I want to welcome Mr. Sidwell Sihauna. You are welcome to grace us with your knowledge, sir. Thank you.
Thank you so much, Program Director. Sanbonan Dumelang. Good morning, colleagues. I just asked Kokete to assist me with presenting. I'm struggling with connecting with my laptop. I think the same challenges that other speakers have encountered. I've encountered that as well. Hence, I'm using my device, my mobile device here. But thank you so much, Kokete, for assisting me. Colleagues, thank you so much for organizing this engagement. I think as an organization, we are, quite excited and truly grateful for this engagement and the invite that we received. And as an organization, we are one of the organizations that we strongly believe that men needs to be engaged in relation to addressing these particular challenges that we are realizing. We are a women organization. ADAPT is a women organization that is working with men as part of the solution in addressing issues of gender-based violence. So we have a program specifically designed to engage men. We call it the Men's Program. And what informed this particular program, it was informed by a number of women who would come to the organization for psychosocial, because as an organization, the core business of the organization, it's to provide psychosocial in relation to gender-based violence issues. When it was established, the year 1993, 1994, I think that's our next slide. The focus was mainly to ensure that as an organization, we are going to ensure that we focus on addressing issues of gender-based violence. And it was informed by a number of women who were experiencing issues of GBV during those times, the year 1993, 1994. Our first officers, they are based at one of the biggest clinic within the community of Alexander Township that we call Masakani Clinic. And that area on its own, it's the area that in the clinic, it's the one that informed the existence of this organization. The lady who started this organization, her name is Matsilo Mutsei. Majority of you might actually know her. She's one of the activists within the field of gender-based violence, well informed within the content of issues of gender-based violence. She's the one who started this organization. And when she started, she was informed by a number of women who were visiting the clinic due to abuse that they were experiencing. They would go to the clinic, they will see a doctor, medical examination will be done to those number of women, but they will be sent back to their respective homes. She then realized that there's a gap, that doesn't allow the psychosocial part to be introduced. She then started this organization and she was given an office within the clinic. That's when a doctor will examine those number of women who come to the clinic. They will then be referred to ADAPT for psychosocial. But the interesting part that informed us to end up working with men, it was those number of women who were visiting the organization for psychosocial. The majority of them spoke about their partners and indicated that the abuse that they're experiencing, it's been done to them by their partners. And at that time, they were referencing a lot on the heterosexual relationship. We then, as an organization, realized the need for us to establish a program that we call the Men's Program, where we are able to have male social workers who would be able to engage with men, and try to come up with ways on how best we can address, issues of gender-based violence within our society. The ADAPT Men's Program through the counseling, where we are able to say, let's help one another to unlearn those abusive behaviors. And that oftentimes, tend to take place through the psychosocial, that would be given to a number of men. We have men who are regarded as perpetrators of issues of gender-based violence. Some of them, they self-refer them to the organization. Some, they get to be mandated by our justice system, whether it's through the magistrate court, to come to the organization to attend those particular psychosocial. Some, they are survivors within the content of issues of gender-based violence. They are experiencing gender-based violence. They are coming to the organization for psychosocial due to the abuse that they are experiencing. Some, they come to the organization because they also need to be, supported through the justice system. That get to be informed by the cases that they have opened within the content of issues of gender-based violence. And as an organization, one of the key things that we do, literally saying, we need to provide support to these men. They are experiencing issues of gender-based violence. They are perpetrators. How do we help them to unlearn those abusive behaviors? We do that under this particular program that we call the Men's Program. That is done through the psychosocial, that is done through other programs such as the criminal justice system, where we provide legal counseling, legal support. We do those court accompaniment. for people who are experiencing issues of gender-based violence. I think I'm focusing more on men being guided and being informed by, the focus of today. Hence I'm making a lot of reference and in relation to programs that are mainly tailored, to targeting men or responding to challenges that men are experiencing within the content of issues of gender-based violence. We do that through the men's program. We do that through the, the counseling and other programs that we have, project that we have under the men's program. And I think we'll explore a bit more into those particular, engagement. Those are some of the objectives, that we have that speaks about why we are doing what we are doing. Mainly one of the key, objective is to create a healing cycle for men. We want men to literally heal from, this trauma that they've experienced. We've realized, and you draw this from, evidence-based, that clearly indicate that majority of perpetrators of issues of gender-based violence, majority of them, they've experienced issues of GBV. It's either they were raised in the families where gender-based violence was exposed to them, an environment where gender-based violence was normalized, was exposed to them, that on its own form part of the trauma and the learning. So how do we create a healing space for men to come and talk about, some of the traumatic experience that they've experienced for them, in order for them to be able to heal? That's one of the objectives that we have, and in terms of these different interventions that we are putting in as an organization, we are trying to ensure that we achieve this one of the key objectives, to increase men's understanding of the root causes of violence in the home and in the society. That's one of the objectives. How do we do that? That has to be done through, psychosocial, through workshops, through the men's forum engagement, through the campaigns, through the workshops that have been facilitated. And I think we'll explore a bit more in relation to that. To develop interventions programs, those are some of the, programs that gets to be developed. Oftentimes, for us to be able to develop, you draw a lot of information from majority of men that you are meeting with. You are able to realize the gaps. You are also being guided by the evidence or the data that you collect, whether it's anecdotal data, that you would get, that would be able to assist you in terms of developing those key activities and programs that are designed to assist, to address these challenges that we are experiencing. I think one of the key, project that we are implementing, I think is the next slide, Koketso. It's the prison project. As an organization, we are also working at one of the, a correctional center that is called Luko Prison. And majority of the inmates that we are engaging with are inmates that are incarcerated in relation to cases of sexual violence, and some of them it's in relation to cases of femicide. So those are gender-based violence cases that literally made them to be, incarcerated. So when we work with them, we are working with them mainly to ensure that we help them to, better understand these particular issues. We help them to, move away from, not, accepting and, being well and knowledgeable about why they are incarcerated, because some they are in denial. You would hear some of them, when we start indicating that they didn't do what, made them to be incarcerated. And we are not taking away the fact or some of the cases that, you would hear of people wrongfully being incarcerated. But when we engage with them, one of the evidence that we draw, at the later stage, we are able to realize that they are now understanding and they are able to indicate that, and linking it with the key definition of these particular issues that we are talking about, indicating that they are now in a space where they understand why they are incarcerated. They are now in a space where they are able to, approach these issues differently, being informed by the knowledge that has been provided, to them. And we do that under this particular, project. And the key around it is us knowing very, very well that These are individuals that at the later stage, they get to be released. So one of the key things is we want them, when they get to be released, when they are coming back to the society, we don't want to see them committing the same offenses that made them to be incarcerated. So working with them, empowering them, for them to be able to correct the behaviors that made them to be incarcerated, it's through these engagement and through these trainings that we are providing for these particular inmates that we are working with. And those are some of the key objectives that we, as an organization, under this particular project, we are trying by all means to ensure that we achieve those particular, objectives. Assisting inmates in their healing process, that it's helping them to progress from their denial stage to accepting their situation. One thing that I also, touched on, to assist the, wardens to realize the importance of their role in the rehabilitation of prisoners. Very important, because correctional centers, they are regarded as a place where we need to rehabilitate those who are serving their time, for them to better understand these particular issues. When they get to be released, we know and we are comfortable that they will start approaching these particular issues differently. So to train both the inmates and wardens in relation to this, to provide counseling services for inmates and wardens. We have social workers that goes into correctional centers. They are also providing one-on-one engagement, psychosocial, to inmates, that we are working with. So that is done through this particular project that we are implementing. Next slide, please. Okay. So these are some of the key community approach that or activities that we get to implement as an organization. When we are working with men, I think the first one that it's more common, that I think we talk about it a lot. Those are the men's forum engagement. The men's forum engagement, they can be brought. I must be honest, and we strongly believe, being informed by the experience and the data that has been collated from these particular engagement, the men's forum engagement, they are able to assist us to shape the interventions that we are able to put on the ground. And then secondly, we are able to ensure that collectively with members of the men's forum, we are able to go and address issues that we are realizing that these are issues that men are struggling with within the content of issues of gender-based violence. It's so nice to go to a tavern for a tavern engagement, knowing for a fact that men's forum members, they are here. When we do the tavern visit, we are doing it together because we have set and planned the topic, being guided by the commodity of the challenges that we've realized that men are experiencing within the community. When we go to those spaces having more men who are well trained within the content of issues of gender-based violence, who clearly understand these particular issues and go in there to speak to other men, it becomes more impactful. And where do we literally sharpen and ensure that men are empowered? One of the key, forum is the men's forum, meetings where we come, we train one another. We are able to deal with, some of the act that we have, that when you are dealing with issues of gender-based violence, you can't run away from tackling those particular acts, because they bring a better understanding of the challenges and the subject that we are dealing with, and acts such as the DVAA, the SOMA Act, us ensuring that men who form part of the men's forum, they are clearly well capacitated and they are taken through these particular trainings, gender sensitivity, issues around masculinity. Those are some of the key aspects that we are able to deal with. And they will be able to provide guidance and be able to indicate in relation to the challenges that they are realizing, in relation to, issues of gender-based violence, indicating that there are these commodity of these or common issues that the trend that we are realizing on the ground, that we as men, we are suffering. And then we are able to plan in relation to that. The current affairs, we are able to unpack and deal with the current affair that speaks to the subject matter that we are dealing with. And we do that through this particular engagement. We I think it's because of the time, Cookie, but maybe to indicate that, some of the key activities, we spoke about the Men's Forum, the community awareness campaign. These are the campaigns that gets to be led by men, and those are the campaigns that we are able to develop them, whether it's through the Men's Forum. We also have the sports and recreational programs. I think one of the key, activity that we are implementing, and especially within the soccer, field. It's for us to ensure that men who go to soccer field, men who are playing football, teams that are participating in those engagement, we are able to organize a tournament, and that is the tournament where we are able to empower men in relation to issues of gender-based violence. Before we kick football, we must participate in trainings. When we kick the football, we must have certain introductions that will be able to address the subject matter that we would have said within this particular or this year we are dealing with intimate partner violence. The soccer tournament, it's mainly designed to address IPV issues. We train them in relation to IPV messages before captains, before they can start the soccer match. They are able to have positive messages that addresses intimate partner violence. They are able to share what they are committing as a team to be doing in addressing the subject matter that we would have dealt with. And that you draw that from the focus and saying within the sport, because that's where you'd find most men. How would we also tap into those spaces, ensuring that we address these particular issues that we are talking about? Workshops and community partnerships. Now, recently, as an organization, we are working with the Community Policing Forum, that is the CPF. We're working with sector managers. We are working with the GBV unit within the SAPS. And this was informed by, the challenges that men are experiencing. There's a lot of anecdotal data that we are still collecting on the ground that speaks about men not feeling comfortable to go to police station to report gender-based violence cases. They still believe that they will be mistreated. Some, they are able to indicate that they are being mistreated when they go to, such spaces to report, issues of gender-based violence. Us, in sitting and saying we need to respond to these particular challenges, we then, collaborated with these structures that I just spoke about, and developed an approach of developing or facilitating community workshops that are mainly targeting men within different wards or sectors within the community of Alex currently. And that on its own, we've realized that men come. We already facilitated 2 so far. We've realized that men come, and when they come in numbers, and they are able to share the frustration, their understanding within the context of gender-based violence. You are there able to provide, a better understanding within the subject matter. You have SAPs that are able to explain the reporting procedures and encouraging men to come and report gender-based violence whenever they're experiencing them. That on its own, it's also being informed by responding and ensuring that when we speak about, community engagement, and especially that are focusing on men, we are able to create that safe space and saying we are inviting only men to come to these engagements so that they are able to openly, engage around, these particular issues as men, and collectively we are able to think about, strategies on how best we can, collectively address some of the key issues that would have came from those engagement. So those are some of the aspects and one of the engagement and the focus areas where we are able to focus and engage men. Young Boys Project. Within the men's program, we've realized the need for us to ensure that with young boys. We then took an initiative and saying, within the community of Alex, we are going to go to high schools. We are going to collaborate very closely with the Department of Education and go and work with young boys within schools. And we are quite happy with the, the results that we are realizing from these particular engagement. We have a project in high schools that we call the Young Boys Project. We are addressing issues of gender-based violence. We are responding to issues of policies where we look into the school code of conduct and ensuring that we develop an addendum that speaks to gender-based violence issues that we are able to realize that they are not incorporated within the school policy. That will be able to address the misconduct and the corrective measures. And we are quite happy that this particular process, we are able to take it forward, working very closely with these young boys under this particular project. We are doing that as a way of ensuring that when these particular issues occur within the school, we know for a fact that there's a policy that it's well recognized by the school management, by the SGB, that will be able to respond, on how such issues should be handled. That will be able to provide guidance and how, the school management should respond or should address those particular challenges, so that when young boys within their school are developing campaigns, and those are the campaigns that have been designed and developed to raise awareness, to empower their peers within the content of gender-based violence, they know for a fact that we have a policy that backs us, that will be able to address whenever such issues, are being reported within our school. So we do that in a number of schools, empowering young boys, and we are quite happy. I think we've seen a positive shift. There's a project that we once facilitated at areas of Everton, Sebokeng, in partnership with people opposing women abuse. We as an organization, we are focusing on working with boys within that particular area. And some of the results that we've realized, some of us now lately, and those are the, a huge impact, from majority of the young boys that formed part of this particular project. It's their involvement, what they are doing now, their understanding. Some of them, they are in a space where they are able to be invited and become guest speakers to some of the, engagement that we are implementing and facilitating on the ground, because they are now seasoned, they are understanding these particular issues, and they're able to bring the current context of the reality that is taking place and being able to address it. We then realize that when we work with them as young as they are, when they grow up, they are able to literally, better respond to these particular issues. I think with that said, with the interest of time, colleagues, I think that's where I will pause. Thank you so much. Back to you, Program Director.
Thank you very much, Ke a leboha. Colleagues, you've heard it. Let's meet individuals where they are, rather than expecting individuals to navigate distant or unfamiliar systems. Thank you very much for those programs, and I could hear that they're very inclusive. So it brings me now to our next segment. We are now going to delve deeper in the lived experiences, the voices where, as practitioners, as technocrats, we don't hear every day. So we are now going to move to the mental health, identity, and a sense of belonging. At the center of today's program are voices and experiences that statistics alone cannot capture. Lived experiences bring depth, authenticity, and a human dimension to policy discussions, of course. So it reminds us that behind every framework, colleagues, every intervention and every conversation are individuals navigating complex realities of identity, a sense of belonging, and mental well-being. So now we are honored to hear from Tshepo Musamo, who will share reflections grounded in lived experiences. But before I can do that, Tshepo is from Springs. Tshepo represents the East Rand Youth Coordinator. Tshepo is from Springs, and he's the East Rand Youth Coordinator of Ekurhuleni Pride Organizing Committee and the National Chairperson of the Youth of South Africa Queer Movement. So Tshepo, you are welcome. And Tshepo is here with us in the office. So he'll be the one who is going to share the reflections grounded on his lived experiences. Thank you, Tshepo. You are welcome.
Thank you so much for having me. Well, to start off, understanding a lot of things concerning our sexuality and my lived experience as a queer person in South Africa, living in the rural township where we experience the horrors of how bigotry and queerphobia can affect a young queer person's state of mind. I myself have experienced it in the hands of family members, people who are supposed to protect me by obligation, and to actually understand that they were not for me and or against me. It was very sad. And growing up already as a Black person, a Black man, you have this thing of being told, Guti, indoda ayikhali, men don't cry. So you had to suppress those emotions, and to the point of lashing out in the community. You can't build proper relationships outside family. You cannot establish bonds with other people who come with good intentions. And that trauma defines you. You cannot tell right from wrong. You turn to substance abuse as a form of solace. And you just find yourself spiraling with no point of return. Some have actually had the unfortunate situation of suicide. And it only comes to the realization after their death that being a Black queer person and having mental health because of rejection is very important to address. But because of our elders who are very ignorant and very recalcitrant, it's very frustrating because you cannot address them and tell them that I am gay, I have attraction to people of the same gender, or I have secondary orientations, because they'll perceive it as some sort of abomination. They will then cite Western cultures to blame. They'll reference other things. I've met young queers who often told me that my parents would be like, it's because we sent you to a Model C school. That is why you have these ideas of thinking that you are gay or bisexual. These things don't happen in our communities. It's the same thing I've been told growing up, that there's no such thing. There's no such thing as being queer. You don't have a present father in your life, or you hang out with girls a lot. Those things stemming from the fact that it's ignorance, and at this point, being ignorant is a choice. So my lived experience and my identity and belonging in my community, especially, you have the sense of, I am very confident because no one's going to do anything because I own it. That for me is a privilege. In other rural township areas nearby, you owning yourself, it's an invitation for violence. I come from an area where one of the hate crimes when I was young, it brought attention to the whole world, the late Judy Simelane, the way she was killed, just because she was a Black queer woman. You have that thing as well, that I could be next because I'm confident. Then now we have to suppress ourselves. We have to suppress our identities. We have to suppress our emotions because there's a certain expectation we have to go through, So unfortunately, we have to constantly live to the expectations of our elders, because it is to our elders that we owe everything, someone once said as well. So, in other words, we constantly have to fight. We have to fight the fact that we are trying to find ourselves. We have to fight the fact that our parents, our elders, don't want us to be our true selves. We have to live according to them. It's a lot of things. It's a kaleidoscope of things. Mental health wise itself, you have the classic young queer men who are rejected by their fathers, often seek comfort outside their families, older men, because when you ask them why are you dating or chasing older men, because I'm trying to find validation from an elder male. And often that becomes very tragic and very troublesome because those elders, they are trying to take advantage of the fact that they are trying to find themselves, the power dynamic. They're using the experiences, they're using the authority to try and assert dominance over young underage queer men. So the mental health, it deteriorates even more. It becomes much more worse. So it is very important in Black communities where there are young queer men, young queers in general, that they have to understand and bring themselves to learn, to understand that young kids can be queer. You know, they cannot be just heterosexual, cisgendered men and women. They're queers, they are gays, they're bisexuals, they're lesbians, they're transgenders, and so on and so forth. So in conclusions, colleagues, I just want for all of you to understand, and I'm imploring you to actually just go out there and understand that we as activists, when we do sensitization, we are trying to bring elders who don't know better into spaces that they have to know better, so their kids can understand that we as activists, we're trying to get the parents to understand that yes, your kids exist. They're not just straight boys and straight girls, you know, they're just free to be themselves. I thank you, colleagues.
Thank you very much, Tepo. That was very profound. Thank you for that powerful and courageous sharing. It is through voices like this that we are reminded why we need to do this, colleagues, why this work matters, right? I warned you and I told you when I started that this dialogue is going to follow a intersectional commentary. So we are now left with our last speaker, still on the lived experiences, but now we are going to spotlight on higher education. So a young man, particularly in higher education environments, face unique and often under-recognized pressures. These include navigating identity and masculinity, academic and financial stress, social expectations, and belonging. So these expectations can significantly influence mental health outcomes and long-term well-being. Understanding these dynamics is essential if we are to build preventative and responsive systems early in life. I now invite Washu Mulawudzi to share his perspective. Washu, the floor is yours, sir.
Good afternoon, everyone. Thank you for having me. Thank you for the invitation. In higher education, a lot of students struggle with anxiety and stress. And this is because of the demanding workload, and also just the new environment with new procedures and stuff. This makes everyone anxious and stressed for sure. But then with the males, they're already conditioned to not seek help or not seek any healthy coping mechanisms. And this is because of the society that we live in. Men are told that mental health is taboo, as in they're not actually allowed to like feel any other way apart from stoic and strong. So this forces them not to show weakness, to suppress all their emotions, and it leads to stigmatization. Me especially, I have started my first year in LLB. I was not familiar with how tertiary works or how the online space worked at UNISA's online learning. However, I was able to learn and still like adapt, but still it was harder than it would be. I don't want to say if I was a female, but it would have been much easier if I was able to ask for help from the get-go instead of learning everything on my own. But anyway, the campus services, most people say the campus services are not very helpful when it comes to mental health and helping men with coming to terms with their stress and their emotions and their anxiety. And this is, I've heard from multiple other people, not me especially. We're discouraged to not be vulnerable, so we just take on everything by ourselves. This is an issue due to the fact that I have started taking stress medications and seeing different therapists and psychologists because I refuse to show vulnerability. I refuse to go out and ask for help and come to terms with the issues that I've been building up over the years. And it's only now when the stress has become way too much that I can't fully find good ways to cope with it. But anyways, school is stressful, but it is more stressful when you don't have anyone to help you, and you are told that getting help is taboo or is not what men are supposed to be doing. Men are supposed to be helping others. And unfortunately, that's all I have to say. Thank you.
Thank you very much, Washu. I can hear the pain and the trauma in your voice, but thank you very much for really trusting us and sharing, your experience with us. It's also an opportunity for us, to take note, to understand that as much as there's work done in higher learning institutions, even us as an institution, we have done work in higher learning institutions, right? It's also an opportunity for us to delve deeper as well and, look at the areas of mental health issues, because indeed they do come in ways that we have never imagined, and they are unique to you. Thank you very much for really being vulnerable to us, Washu. So, colleagues, we have Washu was the last speaker. So I want to invite everyone and also our speakers, please be ready. This is now a moment where we move into a part of today's engagement, our interactive discussion. So this session is an opportunity to reflect on the insights shared, engage directly with our speakers, and deepen our understanding through dialogue, right? So I'm going to ask that we either write on the chat or we raise our hands. I will take 3 questions and then I'll allow the speaker to respond. Then I will take again 3 questions and I'll allow our speakers to respond. So we are now on 12:23. We're still doing well with time. I am pleading that at 12:45, we should be wrapping up with questions and answers. So I will open the floor for a focused, a solution-based and impactful panel discussion with interactive questions. So I can see a hand from Minentle.
Hi, colleagues. How are you? My name is Minentle Mbandlwa. I work for CGE as one of the researchers. So the topic is quite interesting, and thank you for such an insightful dialogue. So I wanted to understand in terms of the NGOs and government institutions that are doing intervention in terms of mental health. I wanted to understand what kind of data collection methods they are actually using that informs their policies, and what kind of intervention they can actually propose in the age of social media, as you have said that we need to redefine manhood and the expectation that is expected from men. So that's just my point for now on redefining manhood and what kind of intervention we can use to respond to the social demands and the data collection methods. Thank you.
Okay, great. Thank you. And I will have Annette.
Good afternoon, everybody. Thank you very, very much to CGE for organizing this critical conversation, but also the presentations from experts and practitioners in the field. This has long been a serious issue that deserves much more focused attention. It's obviously arisen sharply within the GBVF space. Just a few comments, if I may. I think especially a number of speakers spoke about the intergenerational trauma, and the colleague from the Ekurhuleni spoke about the violence in the 80s that has affected people's mental health. I just wanted to add to that in fact, if you look at intergenerational trauma and violence, we need to go right back to colonialism and apartheid. If we're talking about identity and the disruption of identity, and we sometimes forget that. So, I know it seems long ago, and we are part of the dialogues in the national dialogue. And people say, well, young people are saying, why are we so violent? That's possibly a starting point. And I think, there are many, many answers that have been provided here. I think what's also very insightful is that we have a system of unequal power relations, harmful gender norms, and so on, and we all know that. And we have a system of patriarchy. But what we sometimes forget, and I include myself here, is that we tend to believe that, the system of patriarchy means that men are better off. And I think it's very clear that both men and women suffer from the current system of power relations. I think, I would have liked to have seen in this session, but, I must say CGE has covered huge ground. We have a National Mental Health Policy Framework and Strategic Plan that was from 2023 to 2030. And from my experience, I am currently civil society, but I was previously in government. There's huge resistance to actually improving access to mental health services, so for me, that is something which CGE can do to assist in holding the Department of Health accountable. And I'm talking here provincial, national, and in certain instances, even local government, to actually just take mental health services a lot more seriously. And then just the other issue is that the media colleague spoke a lot about the issue of narratives and how to construct certain narratives. And I think that it goes, even if you look at cartoons and, violence, in my view, is still, perpetuated and strengthened through multiple media forms that people have access to, across the different communities. And then if we look at the ecological model, these social norms are reproduced throughout our social institutions, whatever you want to call it, whether that be schools, families, faith-based organizations, I think also have a very important role to play. And then finally, and we need the GBVF structures have started to do that, but I think it needs an all of society approach to make impact. And then finally, the issue of a knowledge hub. The GBVF structures, again, have started to do that, what works. So, for example, ADAPT has given us fantastic examples of their work, and it seems their work have proven success. So, just that evidence-based approach and putting resources into interventions that actually work. But thank you very much for this event.
Thank you, colleagues. So I will allow our speakers to respond. I know our Can we allow the speakers to respond?
Thank you very much. I think perhaps let me take on the first question in relation to, how do we conduct data, like especially before we start a program or an intervention. I think the common way of doing it's either you start with the baseline. If it's a new project, a new intervention, you would always be guided by, developing a baseline. The findings of those baseline, they'll be able to just give you an idea of which areas and to focus the activities that literally needs to be implemented because of the data that you would have collected. When you analyze it, will actually give you that. So oftentimes it will be the baseline, you do your midline, and then at the end you would also do your end line study. So that you are able to track what you found from the baseline. Midterm, where are you? Are you still responding to, the actual issues that are taking place within the society? Are you able to realize the results that you would have set? And then at the end, you then are able to measure entirely if the project did achieve, did you manage to get the results that you set when you tailored this particular engagement or project? So we normally do that. If it's, I think another way that we would normally, look into it, it's if it's workshops, it's either we administer, questions, pre and post assessments, pre just to check where people are in relation to that particular subject. I think from our side, it assists so that you administer the pre-assessment, you check their knowledge, that is before you engage with them, before you unpack that particular subject. You then at the end administer post-assessment, and then you'll be able to measure the two, before this is where they were, after you've conducted that particular engagement, where are they now? That gives you a clear picture if they were able to move, if they are now in a space where they understand the content differently, and you will draw that from the pre and post assessment that you would have administered for that particular engagement. I think that's another way of approaching it. I think in relation to media engagement, and I think a colleague will come in who literally spoke a lot in relation to media engagement. But I believe, how we consume data from social media, I think that's how we are also able to analyze and be able to counter that particular narrative that has been presented, and saying what are the things that are being most talked about, and how do we change the narrative. It's either you go the route of the podcast, but your podcast, it should be different. And I think a colleague indicated that the content that you consume, how the the system or the internet would often operate, it will keep on giving you what you feed it. They get an idea of what you want to, learn about, and then they literally bring things that are similar to that. We can start those podcast engagement that specifically focus on addressing the subject matters, just for us to ensure that, we are able to dismantle some of the content that perpetuate the subject matter through, ways that we know that people will be able to consume that data or that information through media.
Thank you. Before we can move to the next respondent, I also want to expatiate on Annette's comments on the mental health strategic plan from the National Department of Health. Yes, indeed, it is silence. It is very, very quiet on disaggregating data on mental health access, so that is actually a point of entry where we can lobby and also really, find ways in how we can work together to make sure that the strategic plan moving forward, it is really inclusive and it looks deeper into the diversity of mental health, but importantly, access. So I said before, colleagues, that this is a collective problem solve and shared accountability that we are going to participate in. We also have Tshepo here who would like to also expand on the information dissemination and education that they give in the community.
All right. Thank you once again. So my work at EPOC, especially EPOC, is that we do sensitization on information pertaining to identities, queer identities in disadvantaged townships. What we do is we attend cases of students or kids who have been marginalized by families, educational institutions because of their identities. We get a mediator that is neutral. We address the problems. We try to find solutions as well. When we have concluded that, we also propose that we actually do outreach committee work at the places where kids and students are marginalized, colleges, communities, so as to better teach them about queer identities. We also collaborate with DSDs, Department of Justices as well, to do health and safety, teaching young queer kids about their identities, how they can access health, how we can help them access health that they are denied or they cannot get because of fear of rejection from clinics or hospitals, be it private, be it public. We also approach parents. We do door-to-door. We do community dialogues. We do it in parks. We do it in taverns. We do it in churches. We also organize pride marches. We also organize pride picnics. So we can invite parents to join us and have any questions relating to our work. My work, particularly as a youth coordinator, I deal with young kids who still in the closet, and we find alternative ways to help them navigate their identities without revealing themselves to their parents, because we still have parents who have this thing of wanting to reject the kids because they do not live up to the standard of how they should be kids due to their sexualities. We also help them get counseling. We also help them get a buddy to talk to, someone that they can relate to without much exposing or compromising their identities, because unfortunately we have limited resources and we cannot take on so much of helping them find places of shelters because of parents kicking them out. So that's, in a nutshell, colleagues, is what we do at EPOC.
Okay. Thank you very much, Sebo. I see we don't have questions. I don't see a hand. I don't see any hands. I'm moving to, okay, we have Benia Molekwa. I hope I pronounced your name correct. Apologies if I didn't. The floor is yours.
Good morning, colleagues. Am I audible?
Yes, you are.
Okay, I wanted to ask a question to Tshepo Seko. I think every male has an innate desire, for companionship. So to people who particularly in the field that you deal with, queer people or homosexual people, what do you think the best way would be to engage with them in their navigation of their sexuality in a way that wouldn't be destructive or detrimental to their future, especially with regards to their own desire for companionship with older men because maybe of their rejection or the rejection they receive from their fathers? How do you think the best way would be to, I guess, because I'm under the impression that they are still men, maybe just differently sexually orientated, what would be the best way to like help them navigate that space?
That's a good question. What the best way is to actually have dialogues. Recently, I did a queer teen talk about teaching young kids to actually try and be more open in spaces that are more comfortable as opposed to being comfortable in their own houses, having allyship through classmates, educators, or professional counselors at schools. Because as I said earlier on, unfortunately, we cannot sometimes approach their parents and reveal their identities, but we can encourage them to seek help through our organizations. Each of us at Epoch we are specialized in handling different aspects of their identities, be it how they deal with their identity at school, at home, just in general in the community. So personally, I also offer my contact details on my Facebook page so they can talk to me, or we can do queer walk and talks that I initiate, that we sit or we walk and have questions. And we also teach them about how unhealthy it is to seek other validation from older men who might take advantage of them being lonely due to rejection. I hope I answered your question well.
I see a thumbs up. Okay, thank you very much. We then have Thokozani Dladla. Thokozani.
Thank you very much. I just have a question to the speakers. They've indicated, the first two speakers, ways in which they bring men together, and then they talk about the issues that we touched on today. But I'm here thinking, listening, one indicated that they arrange tournaments, football tournaments, and the other one indicated that they organize music sessions, and then the music session before entertainment starts, they will talk about the issues. But then my fear, and I just inviting their comments on this, the fear I have on such methods is they are exclusionary in nature. Why am I saying so? It's because it presupposes that men are all the same, or it put all men in or under one umbrella, in a sense that the assumption is that men like football. So in organizing a gathering in the name of football, it can leave out so many men who would like to hear and benefit from such programs, but now they will restrain themselves to say, oh, they will judge me because, if I come here to say I'm not a soccer fan, I'm not interested in football, I may be categorized as not man enough, and so on and so forth. And I'm not saying organizing football tournaments is not a good idea to bring men together, but I'm also thinking that it may be excluding so many men who might just benefit from such programs. Thank you very much.
Thank you. Do we have a take on Thokozani's responses? I also note Mr. Selimela, your hand is up. Maybe you can respond to Thokozani's concerns. And then after, I'm going to plead that we wrap up because we have now reached, we are on 12:44. And I said that at 12:45, we are closing the question and answer session. Okay, so yes, just to be fair to the gentleman, so we'll have Ntate Selimela followed by and Tate Sidwell. Thank you.
Thank you so much, Chairperson. It's actually May Silimela, or rather Dr. Silimela.
Oh, apologies, ma'am.
No worries. My hand is up. I wanted to make just a small comment on and appreciate the presentations, but I wanted to respond in terms of media masculinity and mental health. And ways in which perhaps we can advance men's literacy on mental health. One of the key things that I believe maybe we can use media there is by maybe partnering with positive role models. I mean, people that we easily trust and can relate to. Have them. I know that when it comes to gender-based violence, we do that a lot, whether we have people that are already in the public domain to be leading the messages around violence against women and children. So even with men's mental health, I believe we need to increase literacy there and normalize help-seeking behaviors. I had Tabo talking about dialogues. We can incorporate the respected people within our communities to also be sharing. Some do have experiences that they have overcome, have them also there and share those experiences. And I believe by doing this, we can reduce a lot of misinformation and stigma around why men will not deliberately go out there and seek help. Thank you so much.
Thank you for that advisory. It is appreciated. Okay, Tate Sidwell.
Thank you very much. Maybe to start by saying I agree, and I think I agree with what the speaker indicated. Not all men play or love football. Yes, we are aware of that. I think the tournament, the soccer tournament, it's one of the methodology that we are using. It doesn't take away other methodologies where we are able to look into whether it's dialogues, whether it's workshops, where we engage men. But I think realizing that most men gathered through football, and we've seen that it becomes easier for us to access them. We've been having challenges when it comes to inviting men to certain spaces. But now currently, I think we are seeing a shift. This past Saturday, we had a workshop. Mainly, we were targeting on men, and men came in numbers, and we were quite happy to see men gathered in that particular room where we are engaging, about these particular issues. But I agree with you. There are other, ways that we are able to engage men. It's not limited only to a soccer tournament. There are other strategies that we are implementing as different organizations targeting men. But we've seen the need for us to go to where they gather, where they spend most of their time, and try to collaborate with those structures for us to be able to reach them. Thanks.
Thank you very much. Your responses are appreciated. So, colleagues, we are now at the end of the program, and we have concluded the question and answer segment. So I'm gonna call the provincial manager, Ms. Naledi Selebano. But before I can call upon Ms. Naledi Selebano, I want to maybe, sensitize us that as much as we have created this space, for healthier expressions of masculinity, we ought to understand that addressing men's mental health, it's not separate from gender equality or the transformation agenda, right? It is integral to reduce the violence, improved well-being, and stronger and more equitable societies. I'm saying this because a dialogue alone is not enough, but we need to be in a place in our little corners, right, to translate today's insights into action, policy, and a sustained change. So it's very, very important that we also re-examine the assumptions that we've been having in our workplaces, in our communities, out there in other social spaces where we, look at issues of men's health, men's mental health, and other assumptions of masculinities, and also understand that we are diverse. And I like what a previous speaker said, that yes, we shouldn't have an exclusionary approach or neutral programs, gender neutral programs. We need to be in a position where we dissect and we understand our communities, what their needs are, so that from the planning phase, the development phase, and the implementation phase, people can be happy, and also reduced inequalities, can be seen. So at the end of the day, we want to see a society that is happy, that can also benefit from the very same rights and responsibilities that other people are getting, right? So let me call upon Ms. Naledi Selebano to deliver the vote of thanks and formally close the session for us. Emme, you are welcome.
Thank you very much, Gogi. Let me begin by thanking all of you for joining us in this important conversation, for engaging by posing questions, as well as for your insightful comments. I would also like to extend a special thank you to all our speakers, including the Deputy Chairperson of the Commission, for her strong opening remarks, and our keynote speaker, Mr. Mzamo Mbuli, who not only educated us, but also highlighted the various ways in which mental health challenges present themselves for men, as well as the limitations of current interventions. Prof. Kopano Ratele, not so long ago, posed a very profound question regarding the diminishing presence of men in humanities. We may have the best trained practitioners, as Ntate Mbuli alluded to, but if interventions are not tailored to men, such as through gender matching, we may continue to face persistent challenges in this regard. He also touched on the important issue of intergenerational trauma that results from apartheid as well as colonialism. Furthermore, Mr. Tebogo Motlwenya touched on important issues from a justice perspective, reminding us not to use children as weapons during breakdowns of romantic relationships, but also ways in which men can intervene and not flee from their responsibilities, especially when they feel economically constrained. He made that example of a father taking a child to a mall to access Wi-Fi for free. So mental health issues should not be used as a scapegoat to run away. Mr. Jabu Sibanyoni reflected on the role of the media, reminding us of Jonasi, a man from whom the entire globe is still trying to heal. And we appreciate Mr. Sidwell Sihwana for highlighting the vital work that you are doing. I was actually also going to post this to say we hope that you are monitoring, evaluating, and reporting on all of this important work that you are doing so that it can be expanded, but most importantly, that it be made visible, because as society, we are clearly desperate for such interventions. We heard from Tsepo Msamu, who shared personal accounts regarding the experiences of being a queer man, making these issues very real for us. He spoke of the struggles to form relationships, issues of turning to substance abuse as a coping mechanism, issues of feeling excluded, and adopting trauma as an identity. Washu discussed how vulnerability among young men is often stigmatized, highlighting that young men are expected to navigate new realities independently. Asking for help, something that may seem so simple, being viewed negatively. I think, colleagues, we can all agree that at its core, this platform has not only been about bringing stakeholders together, but has been about shifting how we understand mental health. As too often, mental health is treated as a purely clinical concern. But what this dialogue has reminded us is that mental health is also deeply gendered and embedded within broader social justice dynamics. Now, the task before us is to move beyond the fragmented conversations and towards a coherent intersectional policy response. Responses that recognize how gender norms shape mental health outcomes and that ultimately bridge the gap between policy commitments as well as lived realities. I think this point was emphasized on earlier around the current limitation of our legislative frameworks. From the perspective of the Commission for Gender Equality, this work is central to our mandate, as we cannot claim to advance substantive gender equality if we ignore this scary reality that nearly 80% of suicide deaths in South Africa are among men. And what this reveals about the structural pressures that they face, and that these are not just individual struggles, but struggles shaped by systems, by expectations, and by deeply rooted social norms around what it means to be a man. Importantly, we must actively disrupt the narrative that frames gender equality as a man versus women, given that that binary does not serve us. It does not serve any of us. Instead, it obscures the reality that patriarchy in many ways is a double-edged sword. Yes, it privileges certain forms of masculinity, but it also penalizes vulnerability, discourages help seeking, and isolates men, and as we've heard, including queer men, from the very support systems that they need. In other words, the same systems that perpetuate gender-based violence, for example, also produce silence as well as emotional suppression and psychological distress among men. So this brings us to a necessary truth that we cannot dismantle inequality or gender inequality without also transforming the harmful norms surrounding manhood and masculinities. And we cannot meaningfully improve men's well-being without advancing gender equality for all. At the same time, we must resist the temptation to speak about men as though they are single or a uniform homogeneous group. We've learned that they are not. An intersectional lens reminds us that experiences of mental health are shaped by race, by class, age, geography, your employment status, as well as issues of exposure to violence and trauma. So the question we must continue to ask is, which men are we speaking about, under what conditions, and which context? Without this nuance, our policy response risks being broad, disconnected, and ultimately ineffective. There is also a clear need to confront the gaps within our current policy frameworks, as already alluded to, both by myself earlier as well as in our discussions, that South Africa has progressive policies, but they remain limited in their ability to address the specific ways in which masculinity shapes mental health outcomes. This has resulted in a disconnected manner of approach in implementing policy, as well as lived experiences and service delivery. Now, how do we forge a way forward? I think we must be deliberate and action-oriented. We must develop targeted gender-responsive interventions, strengthen collaborations across sectors, And I see a program director is indicating that we are out of time, but I would like to stress these points because out of this dialogue, we'd like to develop a policy brief that we are going to use as a tool for this advocacy work, especially among duty bearers. So it's important that I emphasize that going forward, we need to strengthen gender responsive policy frameworks, develop targeted context-specific interventions, promote transformative models of masculinities, expand access to mental health services. I would have done a disservice if I did not emphasize on how expensive access to mental health is. Even when you have medical aid, even with medical aid, access to mental health services are very expensive with psychiatrists alone. And remember, there is a multidisciplinary team. You do not only see a psychiatrist, but they are ranging. I think the minimum they could charge you is 2.7. Now let's reflect on that in terms of access. We must integrate intersectionality into our program designs as well as implementation, prioritize research and evidence generation, advance workplace and community-based interventions, translate dialogue into accountability. And I want to leave all of us with this important question, that what would our society look like if men were allowed to be fully human, vulnerable, supported, and free from harmful expectations? Thank you, Kweketso.
Thank you very much, PM. We really appreciate that. Was very, very big of you to, go deeper in what we need to do, but you also offered recommendations, and I could hear that these were actually actionable recommendations. So colleagues, our valued stakeholders, these are my parting shots. Thank you very much, colleagues, for availing yourselves. Thank you so much to our speakers, and also your contributions were very valuable. And I also want to say that let's not isolate men's mental health. Also the issue of access is what we need to build on in what is already existing. So we have unearthed new knowledge here, I believe so. We have also critically examined some of the gaps, and I really hope that this is a dialogue that will also challenge, harmful gender stereotypes, and will also afford people to go out there and seek help and support. So the Commission for Gender Equality has a national footprint with offices across all 9 provinces, making our services accessible to communities throughout the country. So if you are here and you know that you are a victim of gender-related discriminations, you can access our services. You can also lodge complaints through our legal services department, where you can also do that through various communication platforms, including email, telephone, and our social media platforms. So I will end there, colleagues, but I just want to say thank you so much for this robust engagement. We really are happy that you made time to be with us today. Let's meet again, and thank you so much. You are welcome to leave the session, colleagues. Thank you.
Thank you. Bye.
Hi, Koketso.
Hello.
Hi, how are you?
I'm good. Hey, Busi.
Hi, son. I joined very late. I was having morning meetings until like just now.
Yes.
So I missed literally everything. I'm just concerned or inquiring whether is it possible that you guys are going to be sharing